it on now?
Yes.
Okay. Good evening, Internet. We're here in Palau talking to you way out there. Kung natutulog tinggal nga na Internet, sento on ringi bitiram gorok tikmuran siya. Okay, are we okay now? Okay. Oh dear. Talwa siya sola marungil usain mergin rogut yan mores nga superstation ng WWFM nga Alfonso Diaz sa Gaafar Uherbelau ang Ministry of Health ram Belao National Hospital. Laban titigil panelists rogu mo murura introduction mang what I do di care gamilo o pangil ko sngay sola mereng asulir adra ngarel Belao tegi de T8AA lobong tadakal murura tegi de Lurior mereng asulir titigil rogu el staff fra Ministry of Health lobong seu murura tegi Lurior mang suadi mo segi de mergoyo de sialan mura Gaafar Uherbelau mbolo mura program di Dela kasus Gaafar.
Talasa man sulang tulik sulang ko Matias Broadcasting Company lol kung gamamara vekkel kung erung mo ngawalurior.
Okay.
Vekkel nga tete alam nga sulir adra ngaril Belao T8AA ra direct joint broadcast.
Oy.
Tulik katukaman lungila talk show gid sa Tuesday night talguk sa dara purine ma uric acid ma again malungil information luguk to ra a diet, good diet, balanced diet, lumangil adorkas.
Nice.
I mereka sulira tirgel kukam no sebil logerager mamlek comment ra talk show gid. Ila kasus tuliga katukuk again nakata umestirar adra bulua update ra tawara reled ra response mura COVID-19 pandemic.
Nice.
Sisit time mga telobonggeta mugtelobonggeta Dr. Dr. Constantine Dela Cruz.
Okay.
Momsada tokoira again the general mental health well-being sa ilmo touch upon na kukura prevention ra stress management ra stress direct nga telobonggeta Dr. Ngirachisau Mekoll niya Director Hospital Clinical Services ra Hospital. Silta mga part ra tegid MOH EOC nga apps operations ngima Tmong Udui nga direct nga tiang gaya Epidemiologist ra Ministry of Health mo mesa tokoira arak tama uur ma Dela arak tamsel tilterong ukmomsa ra tokoira trend ra mortality tokoira akodal ra sila Uherbelau regal na miracle ra kay compare mora el 2020 kita bablul adrogi ra nga sila pandemic ra COVID-19 kaya kita ako ramo line up para topic sige del argasus mereka sulil tedel no sabi ilme ya amar lagi del me Rusiang Kotaro niya direct nga prevention unit ra division of behavioral health ngi ma Dr. Dela Cruz di kaya talgibol ko kay sumrung no dakat sa eljoy gid di kung tete alam nga sulit tigat tedel panelist direct nga telo mong kamama is always incident commander Brother Udui MOH EOC Director of Public Health Share Ngirachisau Liaison Officer Adon Bigger del PIO and nga niya questions lubong comments sabil lo den wara look the text and more sa den wara PIO 775-1138.
Let's see.
Hindi kamal updates 2 weeks since Tuesday ra Kotaro urior. Tirigel nga quarantine lang nga niya 27 ngaring hunda sa gimle announce sa Tuesday lo single imong le lab specialist del mel nga sergi del na Taiwan al May gimle sa bed test ringi earlier this week gimle negative test ringi magdam le release ringi na quarantine ni gemal di Marcel Bachel keringi mer hospital me on sergi dra toko ra lab testing ra lab kita madingi tulig lo sa tadit terung ra time ra lab kita hospital kita tel lab ra hospital ra BNH tiadi imol lab ra time mga mokra testing ra covid mal nga tangat lenggi del imol lab specialist del nasbedel ngwangis suringi ra Taiwan am lami bangget mong nga sira get terul lata del mokra testing na COVID mge the test negative earlier this week no sabi top de el angol ng sergi de lurier ala el remaining el patient may escort na Taiwan till arrive ra July 7. Again, am le test sa gid long arulurior. Le negative rogoy mitigam al mon nga quarantine another a couple of days lomelami sa gid 14-day quarantine period. This time mga ni tirigay gid 14 al cat team members mitigam terul liaison officer, military liaison officer, mga 15 in total. Tirigay direct kan lo subed el test el alsil sa nakalekta specimen el alsil sa within a day or so and to the result 13. Say one day 7 testing. Say milgat mokker lang let tirigay le arrive ra July 9. Wal el alsil sa wal tal sandera May magda milgat mokker sa gid day 7 testing 13. Direktly tulig at sakal mga takil sa tirigay gidil 15, tirigay 14 cat team members, tirigay terul liaison officers, tirigay quarantine dara a government quarantine site. Lani ako ra ring ra adra belulo sa tirigay kalelo ko ra dimle quarantine at tel camp katul nga rang rigil lakal sal ko ra isi a security matoko ra monitoring at hindi so the reassure adra belulo sa tirigay amlay yakadulingit tatilo sa suko mo kome ang girin mo follow arugul quarantine requirements sa gid ra Uherbelau matagil ngil tirgay gid melmon nga ra quarantine nga sa gid site designated site gida aminit pokker ngi but again tangar osisil situation tirgay gupna Taiwan gid melmon monitor til mulmutra next week sa gukul bora test ra day 14.
I see.
Ako ra kung tertelit tirigel currently tangara quarantine ra tayo may gid amal mon el mutmok gid el gid la gid tablol lomrael maral mir el alman dengan isa gid el clol lomrael ar soldado mes el ko mo ana exercise tirigel gid el mera sometime next week o sisil time kada albang ar selong erung ulabong el repatriation flight tirigel el other mar students ngara akwam tirigel el alsil sa walul mul sel ko quarantine tira kwam again the dilulwasing instead of 14 days ra kwam emel belal mut 14 days wasel ne gotlo mrain en wal ble the telgibel godo mangi sel quarantine ra kwam matulmu ra quarantine la ra kwam AD tamlo AD at maningin sing at tilog ra news la sa 87 isel lo final count tirigel lo so yus para quarantine 80 the 80 la adam say the final number do ba tirigel so yus para quarantine lo murel alsil se tal sunday ya we lo ra el mail Uherbelau at the test again it's the negative rogu at the masas kogi se la may eto lo malmi say the 14 days ma testing the required tira sel mer say the 24.
El atirgay del eril la register el ngara quarantine el ang sen number as well change sel bolbrega gel temira quarantine and el sen number why for example ngari change sama the term step out and sen number as well change medio why say the as well increase
why say hindi wat tirgel hook la sel ko tolomrael ngani amle opt out tamle voluntarily opt out tirgel la su ngani at ngartegi lo ngaru lumral opt out tetwa din dia ka sa erol si sobra adal multiil rogul adal ngartegi del lumral me agi del complete sa agi del 7 full days ra quarantine plus ra testing
I see
kamal mal saul tiral gere tulig am direct ko clear up para su mga niya raw ring ra atra blue sa tamot to da terung tira ko mo tira terung mo or replace it and that's not the case ling again rogul ada giril full 7 days of quarantine at test travel nga sa Skogi. So oy mo say sabel mga ta number ending wal din mga sel moryo din da ka replace till mutal mo area so mga niya to.
Okay. Sula.
Sige ako kora tetelet tirigay gidil ngara ako amel mer sige del July 24. Again it tirigay sa lame at mo so is para 14 days of quarantine. Direct tulig direct dilira sero ang erulurior hindi gi momot mokra ku testing tirgel mo nga segi del flight del marael mo manier baby ram la mo kadong mail o get information magim lam ma clear ma contact information itin so again al sum nga niya adal plan el momarar segi del July 24 flight del Moragwam is so al test di lo mo kadong segi del hotline malungin sa ilang mga doon, meron nga kara 775-1310. And sa monastery information, sa mga nga may test.
Okay, tira imora question, okay? Sugume lang let's say 7 days quarantine ra kuam umgot tang arcel wasay tangara quarantine 3 days tamalar sel final test mergo mingil 3 days mergo busuil masas ko gin merbela wasay
Tokora license ni tokora testing taligi be to legal direct. Tokora undas sa baydo gedi testing mo taligi mo kmed sel sa lorael.
Oh, I see. Okay, so the question is, assume the test, say the final test ng area immortal positive, to hold the entire number or group?
Hindi ngayigid al test positive al lotabadi mo isolated ra mo walbol ra kwam mo ko tirigel remaining a test sugum negative at
okay.
Hindi sugum tamer belaw yung aniawan al test positive again nakada tungong gayigid al mora isolation at tirigel rest mutual reset a quarantine at din mo day 1. So for example at sugum tamlay ko radya ka adal sme mo malar sel day 7 testing sel 1 week ra nga quarantine at the test nga aniawan positive gayigid al positive at totabadil mora isolation maroko tirigel remaining el 79 ako reset el mura day 1 mangwan lutel restart quarantine period till plus the testing requirement.
Okay. Sounds good. Okay. Other one.
Gigi ako ra updates tulig at sugum nga niya question sa bedel longes. At sugum hindi ka bike kulingit ra Dr. Dela Cruz mel bukal gigi del morset tara portion ra talk show gidel sa a general mental health well-being wellness.
Okay.
Dekal mamsal babira ko ra ways to cope with stress stress management dahil at time ng albang ra threat ra pandemic. So thank you Dr. Bing for being with us again tonight.
Good evening.
I know that Rusiang wasn't able to join you, but if we can just go ahead with again some of the tips and what you can share with us in terms of stress management and coping and general mental health well-being at this time.
Coming off from our last appearance here, me and Rusiang, we were talking about the importance of sleep, and I believe Mr. Diaz said something about post-traumatic stress disorder.
Right.
So during the time of crisis, there could also be cases of post-traumatic stress disorder, although it's largely known to be caused by war, trauma, or being exposed to a life-threatening accident or domestic violence, rape cases, okay, and other events which might result into a loss, sudden, unexpected loss of a loved one also. As for the COVID-19 crisis, we have seen that the number of deaths in relation to time is very, unprecedented, and it's causing a lot of fear and anxiety in the whole world. And there are even cases because when it comes to post-traumatic stress disorder, it can happen to anyone. So even doctors, there was a doctor who committed suicide because of witnessing the overwhelming deaths around her, and it was very traumatic because when you have post-traumatic stress disorder, it's like you're having these flashbacks about that traumatic event, and then you can also have nightmares about it. So you're having those intrusive thoughts, and then your sleep is also affected because of hyperarousal or hypervigilance. You're actually having just a shallow type of sleep, and that means just the slightest sound of, in relation to whatever trauma that you experience can make you startled and be aroused from sleep. So they don't have good sleep. Okay, and also because there's avoidance. So people who have PTSD or post-traumatic stress disorder, usually they have these symptoms for more than a month, and it can linger on, especially if untreated. Even those who are treated, they might have residual symptoms. So it has become more of a rule than an exception. Okay, so we have to understand people who are suffering from post-traumatic stress disorder would have these symptoms from time to time, even if they receive treatment. And it's very difficult for the patient and the family because they might have misunderstandings that might lead to arguments. Okay, and so it's important also to receive the proper treatment. And in relation to the COVID-19, the children also might develop PTSD, and it's different from them because they might not present the symptoms like those that the adults will present with. Most of the symptoms might be shown in the way that they play. Okay, so if your children are developing or having odd behavior that you haven't seen before, but it can be related to the current crisis, then they can present also with bedwetting, and if it has become overwhelming for the family, then they can also seek treatment with us.
Okay, doctor,
Yes.
Can you give few or some of the symptoms of PTSD? Like nightmares, is that also?
Yes, the triad of symptoms of PTSD would be the recurrent, thoughts about the incident, which can be flashbacks or nightmares about the incident. That's number one. And number two would be in relation to the sleep, would be the hyper-arousal or hyper-vigilance. Okay, so you're easily aroused from sleep, or because you're vigilant of what's going on around you, you're not really having a good sleep. It's just shallow because you want to be awake when something happens. That's why, so you cannot sleep well. That's number two. And number three would be the avoidance. You're trying to avoid whatever traumatic event that has happened. Right. So for those who might be having or traumatized by the current crisis, especially those countries or places wherein they have experienced the COVID threat, they would might just put themselves in a corner, and wouldn't even want to talk about it, COVID. Okay. Right. So those three are the most prominent symptoms of PTSD, but then it can also lead to other anxiety symptoms and depressive symptoms, especially if it has become persistent.
So the reason why I'm asking that is I'm pretty sure that I have PTSD, but I'm stubborn. I don't want to accept it, but I do have time to time nightmares. When I was young, about 18, 19 years old, I served in Vietnam for consecutive 2 years, and we went through a lot of, it's very stressful. You don't know when you're going to make it until tomorrow. I see a lot of people with no arms, dead people, a whole lot of people just laying dead. I was exposed to that, and I was okay. But when I returned back, I started having these nightmares and loss of sleep, and I catch myself from time to time that there is a time that I go and squeeze myself into between the wall and the bed, and when I sleep tight, that's when I get a good night's sleep. So I said, something is wrong with me, and I asked questions around. I said, you better go see a doctor because you probably have a PTSD.
It's interesting that you served in the Vietnam War because that's the time that PTSD became known, okay? The symptoms of PTSD made the people more aware, or the medical community. and it came to light that in the 70s and in the 80s it came up with the term PTSD because of what the veterans from the Vietnam War experienced. So it's really a traumatic experience. But most of those who witness a traumatic event won't develop PTSD, mostly. Okay, but there is a possibility that it will be a delayed reaction, like what happened to you.
Yeah.
Okay. It can be even delayed by several years, especially those who have, who have been sexually abused when they were a child.
Yeah.
They don't really comprehend what happened during that time. But as they grow older and realize what occurred,
I see.
They may develop symptoms of PTSD later on. So perhaps when you were still during the time of the war, because you have your fellow soldiers with you, so you have something in common with them, and so it has not really made an impact on you at that time. But when you were out there, when you got out, and then you had those nightmares, because it stays with you. That's how the flashbacks and intrusive thoughts work. Okay, so they linger in your subconscious and in your mind, and that's what causes the stress. And you might develop all the other symptoms of PTSD, such as the hyperarousal and avoidance. Okay, and it's important that you seek treatment for the condition not to get worse.
I see.
Yeah.
Yeah. Well, there is quite a few veterans that are living here in Palau, and they went for a checkup, and they found out they had a PTSD, so they're compensating them by give them so much money per month, for the rest of their life, and they're right here. There's a group of them, they have a meeting every Wednesday, and they talk about their problems, and then help each other trying to get the information as to where can we go to get the process all this claim and see. And I know 2 or 3 of them already got their claims in, and they got the money for it. But the only part of it that I really don't want to go and have it in my medical record saying that I'm mentally incapable of something, or I have a mental problems, that's what they told me, that if you go see a doctor, psychiatrist, and then your problem was related to mental things, they're gonna put it in your record permanently that you are mentally ill, something like that. That's why I'm kind of hesitant of going forward, to pursue that, the problem that I have. But I think at 70 years old, I can probably just deal with it for the rest of my life.
Well, that's the stigma that we're fighting.
Yeah.
That going to a psychiatrist would mean that you're crazy, you're psychotic. Yeah. But the thing is, if you receive the treatment, then there would have been hopefully an improvement in your situation or condition, and hopefully you will be more knowledgeable and more equipped when the symptoms recur, or because like I said, it can linger on. There might be residual symptoms, and it could last a lifetime. So if you have the proper counseling and pharmacologic therapy, then hopefully you would also have a better coping mechanism. You will be more equipped to handle your symptoms in the future.
Yeah, we have to be, when I was in the Army, we have to be careful about it, because, like, for example, if I applied to drive a big 18-wheelers truck, and then they ask me, do you have any mental illness, or have you experienced any mental problems? And then if you check mark yes, and you're out, so we're kind of careful about that. They're going to use it against you. when I was in the Army. That's why I didn't want to go forward with my problem, because I didn't want my friends to say that I'm mentally ill, you know. So I didn't want that to be known. But right now, I have these nightmares, and it's the same thing, you know, like my friend got killed right next to me, and it's every now and then it comes to my mind, you know, like, you know, we cry, I say, help me, and I cannot help him, you know, and then I wake up and I said, why I keep dreaming about that incident, you know, and
but that's the thing. If you have not really talked to a professional about it, then or traumatic memories about that event has not really been processed. So from what you said, I can say that you might be having survivor guilt, which is common among those who have PTSD, especially if they're involved in an accident and they're the lone survivor.
Right.
Okay? So we conduct psychosocial processing also for those who are exposed to traumatic events. We also have the critical incident stress debriefing to screen those who might be having symptoms, because just like those soldiers who are in the war, in this battle with the COVID-19, it's the frontliners who are the soldiers, and the frontliners or the primary responders can also be traumatized on what they're doing or what they are witnessing. So they might be called hidden victims, you know. So we're doing the critical incident stress debriefing and the psychosocial processing to see who among the first responders or the first frontliners might also be needing help when it comes to their mental health, because it is important to, you know, have a balance between the physical and mental health.
I have seen you know, my fellow soldiers, you know, just all of a sudden they snap, you know, and just go outside and look at the sky and the tears coming out of their eyes, and say, hey, what's your problem? You want to go home or stuff? Because we were not aware of that. And after a long period of time, and it just go nuts. This guy, you know, doesn't go to sleep and became so skinny and always negative and shouting, you know, nothing right for him, you know, to a point, and, you know, they medevac. I said, you got to go see the doctor. Something is wrong with you. And more likely, I think a lot of people that were so scared to a point that they cannot take it anymore, and they just snap.
Those things that you mentioned, they describe the symptoms of the realization. Okay, when we say the realization, it's like they're in that moment, but they're somewhere else. They're at that moment when they suffered or experienced that traumatic event. That's why even if you try to talk to them, it's as if they're not hearing you. They don't hear you, right? So that's the realization. And there's also the personalization. It's like when they are in that moment, and they become a different person, you know, they're behaving in a different way.
And they also become dangerous.
From how they were before.
They're kind of dangerous from time to time. Like we don't give him a weapon. We're afraid that, you know, he might just shoot himself. So we take his weapon away from him and then observe him, and then we let the authority knows that this guy is probably snapped. He's losing his mind, you know, and we put him out, you know, send him to the hospital, and then that's the last time we see him. They send him back to medevac, back to U.S. or something.
Yes, because along with PTSD, there's the threat of suicide. You know, the threat for suicide is high when it comes to having post-traumatic stress disorder. So that's one of the dangers that we have to watch out. And self-harm.
Tulik and Dr. B, I think it's important for listeners to really be aware that PTSD, like what you said, it doesn't just happen to combat veterans or people who have witnessed a death, for example, a violent death or a traumatic death of someone they know. But I think it's important for us to be aware that it can happen to anyone. It's not a foreign illness or a condition. It can happen to any one of us, any age, any nationality, and that's based on any traumatic event. So I'm going to ask this, Dr. Bing. In terms of Palau, what is the diagnosis rate, or what's an approximate number of people that have been identified in the community to have PTSD?
I don't have exact numbers, but I think it's safe to say that I've had patients numbering around maybe 10 who had PTSD, and it's not just like what Mr. Diaz said. There are some who served in the military in the U.S., but some of my patients who develop PTSD, some of these are related to rape, okay, and accidents, vehicular accidents. And also those who have witnessed, death, sudden, unexpected death of a loved one.
I see. And most of them are women or men?
Most are men. By statistics, it's more common in men to have post-traumatic stress disorder.
Okay. And if if a family have some kind of a family problems for a long period of time, and nothing seems to be right, and that causes a lot of commotions in the family, and husband against wife, wife against the husband, and then the children are involved, and all of a sudden, there's somebody get hurt or killed, and if we get identify these people ahead of time, we can give them a professional counseling to help them out.
Yes, the domestic violence cases, we have also encountered those who have PTSD, and also bullying cases in schools. So I've had a patient, maybe two, okay, who had PTSD in relation to bullying in school.
So yeah, the reason why I ask is we want to make sure that we're not making it sound like it's a non-issue in our community. I mean, the number 10 is probably low, but compared to our population, it's something that we need to be aware of, I think.
And also the children are committing suicide, here in Palau. They hang themselves for a reason, and we don't know what's the reason. They just, go and hang themselves, and we don't, if we could have knew about it, we probably can help that child before he takes his own life.
Well, that's the thing. The children, they behave differently. Like with an adult, they can express their feelings. The children, they might not really have an understanding of how they're feeling. So, like I said, they might express it on how they play, like I have a case in the Philippines, who watched this movie, 2012. It's about the end of the world. The Mayan, and the special effects is so real that the child thought it was really going to happen. So she was really scared, and then she suddenly didn't want her parents to go to work. And then when we made him draw something, his drawings were, about the end of the world thing. That's the theme, and it's mostly negative, and it's dark. The shades are dark, so you can sense that with the children, you might not really expect the symptoms that adults are manifesting. And also there are those who mask their depression.
I see.
So it's important to really be aware of these things, to be able to catch symptoms of depression to prevent suicide.
Yeah. Gaafar, comment on the clinical psychiatrist mo.
No, I think it's a good
discussion,
and I think it's necessary. We don't talk about it enough. Unfortunately, we have to wait to experience a worldwide pandemic for this to come out. So I think what we're going to do as well, Mr. Diaz, we'll cover these topics more after the pandemic, along with Torgas. But again, going back to what you said about the stigma, the key is that we need to seek help if we need help. ng sige dia kumdas ng control barrier ra other especially parents lura am lamat tabang yang aligil wasing ngani ako ra issue ti de matiturul sa mo kangi at the same time tegi del doctor del wasit tabuk mol mel mo so isa para BH baby de tir marceliri ra mo o malaya sa malup tamalngul wasit ti ka kalelo ko ra kalsak sige dia kumdas control barrier. So Dr. Bing, thank you for sharing. It's something that we need to address more, and then have people be more confident to at least be aware and seek information, and if hopefully they can come in and see you, or at least make an appointment to come in and talk to you as a professional. Akum da sa tulig ang tegi del wasendir ka case sergid magdatalgi bil salbaak hindi kani imagine at sugum maria case and maria botal ngungil lo sa dan ngire lang mar adam mo aware wasay hindi ka dil covid nga kita Dr. Bing nom sa dara kadomes to kara dal etelaw le accident mar ay matamal kuraman kita mal momring matamal mong ngil akum da sungungil dolmon mertegi del discussion.
No sé. Dia Gaafar kita ang kadang-kadang mal bering belul adre lang. You have to have money in order to survive. Nung mal to ka ngal alem apply el audude mal ngosong se la sem megatabel sem ma sungula ma singirel mora o mangkadel plan sa makirel mora kamaldil. Ya la damit tagit applications and mal dire create up to problems and tol kung das ito talk other pelawa ngariya problems tirin din dia halo tamal proud und dai the stigma re lang dola bel mos prever tirgal adam dia ngariya problem tirin din bring tira method and me public ask for help.
I see. Ang kita Dr. Mekoll ngatel dire sa director ko mo talgibel smoothie at sige din mga mekra kantilarong mga selarong mga director ko moul mga high blood ang kita liwem mga koysura blungurul ma obese ay garo ko di ble mga niya tetelele ngwil teletele maral
le other Gaafar other ngarian other monia problem ertir merkoyo langi olitang selarndri ra rom mal ubet dikyun dio mungul olitang selarndri mga sangara mandertir mga rin dio magay kartial ngari rakal mengania problem ringi dikyun model ko ya siang kan apa lungi laru bentiang telman larun bentio magay kara iringira akal lagi del moment nge mergo help otherwise sige del ngania problem setir mergo either teman mo besang ada mo tiri lo mur alu tu man mo del bul to magay ka itir rakal lagi direct kita symptoms that I know and I've heard about it. Okay, kalau mo.
Thank you, Dr. Bing. If there's anything else, if not, then please also mention how the people can access your services. And
I'd like to thank you also for this opportunity, for helping us spread the awareness about mental health. And for those who would want to seek our services, you can call our BH outpatient clinic at 488-1907.
1907, okay.
Thank you.
Okay, thank you.
Dr. Bing. Tuling mal dilungi la kukta tolmal morsel last part talk show mo sa dagay gidele mortality rate.
Okay.
Itra at mo Dr. Mekoll si ilgura mo gidel morsel.
Okay.
Ako po sige tulig
sige tokta.
Oy. Tingul to kalim sa kabit example ay dito luktora stress sama post traumatic ito ay gahapen ng mama at hospital at tingali ara ore ram dile del mal al pangalay ay dito.
Oy.
Boy, maya mama mo la sa elorol. Mo ba dalal itu utia sister gilo ba dalala melo.
Ole tirasi.
Diyan sa elorol mong diyan sa el mangarger ngang mal abul.
Sí.
O mangi dire que lo osi gange so el morgi mangi tigel uk adman blodo la gal quarantena dire adraf familia ala gal sore el borre mira ka ungal gal mal mege. Tembral o arma.
I see.
Kita ko hindi ka kalsal man serious ko bilang witness kay ka nga di ngari egel stal legal trigger ay higil man. Baela ang kaitang kele tatmo ang gel agara epil mam. Dito masker game more alto dale ala wala mo sa sin kwak ko dal na marang imra flow. Hindi ka tanga hindi ka armadra gobit.
I see.
Iblo all tayo ura ko dal sera 2016 al 2020. Sera 2016 tagaya 176 la ang los mayor sa gilid track. Ba 2017 ang 184, 2018 143, at 2019 at given lo 189.
Okay.
Oh, sel dugura igel man, igel January, February mo, and all what it change the number, kaya 12 January, mas 6 at 2016. March mas 16, sel the average ringi. Parang ulil mo equal rabet sel entire year, sel entire 12 months, nganya sel or average nganya 14 other most every month. Mo atter again number mo 14 Lagra every month. I said 2016. 17 ang 15. Ma 18 na 11, bel 19 na 15. Plus hindi ka sa mal chance dia lo ur. Di average niya di remain leo si sure abek karak. Tawara amlo umar bulur el alira tedi si 16 adam no blamo smer. Es el campaign moraigel previous years en walang araw. Ayaw siya ikidalaw. June.
Tela 2020 ko Tela?
60 lang.
60?
Ay siya.
Okay. Gidam lamo ahefra 2020.
Away, siya.
Madomes umagat to kami siya trend ringi ng 120 let's say. Era endra 2020 mung siya kutun moryo.
Siya wala kutun. Ngario. Kasi ang campaign ba 2019 January na 2019 ang area 18 na lang. Al 2020 te 12 ang wal ngario ra may 6.
Mo ise.
February al 14 ang 2019 et 10 al 2020 mandiri ang ngario. March ang mag-issue ble 9.
I see.
April 14 2019 el andi 7. May 18 el andi 8. June 22, el andi 14. Idriabol mereka July, December July 2019 amle 11, idriabol mereka July elang.
Mo ise.
Puto sih number. Umisin na igalo ura 2020 wala ngarion di dira complete ra.
Sel gol mereka December fiscal year como era October to October and
Dia calendar year man January mo December.
January mo December. Okay. Ya tirgele aul tirgagi dulu tahu dah sudah mal kora mergi Atio velala quando velala con tal ure Gaafar es el líder comprar todo eso del mundo lo dire. Okay.
Me la sentí un molmo flote al stress.
Hoy especially tirgel win bela mo magia outside tirgel da soril ngariam lama ngaria adel seral gerda gel absentee en ona sanga kamos pigeren merden ang titilo der tel speaker siblem lo dia ina pase que el moribang mat se ngara de gordo ge mat melo del mat el tegi de senkyo but anyway magami do el mon me la trui me el boom e coltaldo va doctor Mekoll mal beskida igel gora lula blungur ma direct teletar o teletar raklad ma la khadmat e por mereka tal pandemic akurren serela de Gaafar akriden serela lo hace kadol que dar self vaccine se marat toy no ser modo duradas así disit mul wasel dire
gora dirka ka aba esel update to gora vaccine
ay
to gora di wasera di mga tmok kergi mesel tayam el borngi en at least en kada tmok to gora umrusel rabel wadam segi dagim gora mre eringi kunda sariteram la tal dalilo segi revise still mass vaccination plan. Masil talbor nga vaccine ilbol nga niya bebil ko ra odurok kon mergina ko plingla da Uherbelau mo marare ata umrusel mo ra atra ablu matirigel priority groups gina mo muulo.
Di ka member really wasit tirgel nga ogwidar kir morbaba priority. Di sai gutte va mertial blu la des ele kom gote protector mam se prolong la life mam mi a utte che tigurest. Ya to ngala kan ngania tretelen como ra tretelen la omrusel la vaccine.
Tuling hada di kutet ala ko kira Tmong kung dasing ngania ko ra question sa atrabulul talat yo mesa ambulance ra vehicle sales mitla ko o sa bakandiro sa adal mateng ra kalel covid ka mamagi mumula ke adal kay makmadra covid ma direct kal qura adalo malgol sa kalel malbitak nga adal madra kay gidil NCD landi dia ka osong ra NCD ma kudukura oger at mong lo sa domesra ilalra may gin kotal ra January man mutrel ang ngura wangarak la ka Rusiang ra ku kotal ra gan na umrekra.
Okay, kabo et mong.
Ay Gaafar bilop singi tulige. So domesra igal from igal statistics al gumes el alrak sel gora wa kisal difference igal previous years sel domesra igal age group or other la musmera ulil iragal mi ilanga ngora wal tomasin del maklol over the age of 50 whereas I got previous years by there's more people in the younger age groups in beginning of the year so selwandra blin mentioning ka friend dira ka confirm the cases sa Uherbelau mang dira ka adal mother Uherbelau so next ayel cause of death ayel cause of death al year so far the follow ayel trends in domesra ayel previous years ayel top 5 cause of death ra Uherbelau mostly NCDs ayel hotel first ayel heart disease and stroke followed by carcinoma, cancer, injuries, and mostly male. This includes accidental drowning, and 4 cases this year already, male and female, direct respiratory disease, kidney disease, usually related to sugal, diabetes, type 2 diabetes. So, hindi clock al year from previous years. We just see so far this year the our maklol of older people who've passed away. The following the trends, they all passed away from NCDs or injuries. Yagida ora trends umesel ora follow regal previous years and so mal close to trilla Allah do best say give the very efforts of public health and lisi at preventing NCDs and making sure that maintain healthy give and close to prelam CC avazing ever mabod ko bizing sab ever
fight back.
Why say?
Okay, so ang gila dala mo concentrate ra lifestyle gila modify ngi tel given mo mga balanced meal mo say.
Why say?
Mga balanced meal, exercise lang as well keep your body function.
I say, at time dira ka Uherbelau, pangal ta Uherbelau dira sa bevel lomay sa do mask sa bevel exercise ra outdoors.
I say.
Tugar adra gal bebira balul gakate el tugadra oblili mo exercise or age we're lucky or we're blessed to wasing dir sab even mulagi give almost your give the risk of NCD ma premature death ako dal.
I see.
Yes.
Ela ungo mo concentrate ra tuara NCD en la direct tok la da sab prolonga lang arti.
I say egal raktel NCD sarwa sugal ma high blood I got sab even manage of course you like the doctor Mekoll so he can elaborate more like doctor and I got sab even you can live want to say healthy life, you can live long while having these diseases if you take care of yourself. I say.
Okay, ganun sulang information. Okay, kadolmol. Dili ka ba 7 minutes?
Taga tulig at sumti kaya angot alger ma comments hindi mo na sige dia talk show unless nga niya ko ra.
Biya, man tayo. Manita jobre lang kom na amdirga akidir ko repeat igal la se ki mo extract to say the video tiang I mean audio ora ngirak lugu during the day tirgel tu nakate lead rong sira ko snge ya mos bi rong sira lugu o maki pro ora ngira for next day sel weekend maki direct ora el blasmal reach tirgel rogo il nakate lead rong men sa gagi del dosadra tagi the programmer ko mi Gaafar aki ora ring sen next day media mo dikire se gide mal lamo toka rather lang tevela campaign mara toka rola ba advertisement til mga mem se bebira time tilgib el momeo de toda sel programmer ko undi aki make sure lo sen todo el morapuay
man sulang etulig ka matingil lo sing malungi la coverage sa audience mong sulang sa gid rerun sisil time tegi del live ra social media may internet to kumdas yung mal close advantage do bang reach ra adang Uherbelau o sisil time tigel book baby gid nga outside as civil book tune in mo matingil wasing ra kada madura sa Uherbelau mo close dilo sa kada dito ka silva act for now hindi ka kamatang sme hindi kada malmol malurior kay nga sul gidala o sa bakla de terraktum
muese el madura sular bakar yetkel mga do ma tachika madirga katal koramo nge tial el connection ra
the line o hindi ka man sulang le ulangitra
adra PNCC
mit chekani tegi del malungil maral mo ko hindi malmol malwaisay
man musumra o kyar gide badgas musuma
dia kamang kuman sulang tulik direct kal gim mrenga sulel at 8 mal lolo pang game joint broadcast dilbor segi dia suku mga niya ngidilger again at hotline na malmol mal open mong se irar adlo mo kodong morning 488-0555 hindi mo segi di makuk ongerulorio de tulik ito upeda kaptera talk show
may ikan rogoy
okay sulang
bye You know how many people? Oh, good night, you all. Good night. It's just off us to say good night.